This is our welcoming area in our waiting room, where we have a waiting room for several different areas within the clinic. We have a physician's clinic, an infusion center. We also have a general infusion center and also lymphedema services within the same waiting room. So it makes it, again, the comprehensive cancer center, helping patients treat their entire cancer process or their oncology process as they're getting better.
And where are we going now?
As we walk through, we try to make it again a very welcoming, serene environment for patients, a healing environment, a natural environment for our patients. So again, a soothing waterfall to welcome people and make them feel comfortable in this difficult time of their lives. As we walk through, we have an area we call our meditation room, in which patients can come meet with our chaplain that's on staff, as well as a nursing individual or physician. If they just want some quiet time for themselves, they can have a very soothing environment and talk to one of our spiritual care folks to help them either pray or just meditate or just have some quiet time with themselves. We divide our clinic into two general areas. This area, as you see, we try to make very welcoming and very open for our patients. This is the area we do all of our chemotherapy and our infusions for patients who are actively receiving chemotherapy here at the hospital and here at the clinic. We divide our area into different pods, and we try to give people different options for treatment therapy. We have different chairs where people can have a social time. Some people like to have develop very close relationships with the same people that they're getting treatment with for many, many weeks in a row. They can have privacy by pulling the curtains if they desire. We also have private individual rooms that we'll see as we walk towards the back of the clinic. But again, we divide this into individual pods where we have nurses stations who are overseeing a few patients and monitoring those patients on a routine basis, on a continual basis. We have our own laboratory service within the hospital, within the clinic. We also have our own pharmacy within the center as well, where we have a board-certified oncology pharmacist, the only one here in Topeka, and also a pharmacy technician that staff it throughout the day and do the general infusions and the chemotherapy infusions for all of our patients, servicing only the patients within the cancer center. As we walk towards the back of the infusion area, this is the area that I mentioned that we have individual private rooms where folks just want some private time for themselves to get their treatments. They're welcome to have a private room, and again, we have a nurse's station very close that they can monitor the patients on a continuous basis.
Which is more popular between the two, the open air rooms or some of these more private ones?
Everybody generally likes the open air rooms, again, because they develop friendships. They sit in the lobby with the same people every day or every week, and they come back here and they actually sometimes choose their chair because they generally have the same infusion times as well. So they a lot of times sit in the same areas, or some of them have favorite nurses. Where our nurses sit in the same spots every day, and so they'll sit according to who their favorite nurse is for the day.
It sounds like people enjoy building relationships around here.
It is a special time for people. It's a very hard time for people, but one thing that St. Francis is known for, obviously, is our innovative care with the soul. We try to be a little bit different and provide that special care, a healing touch on a spiritual basis, and patients generally connect with that a little bit. On the other side of the clinic, we have our physician's side of the clinic. So again, we try to be convenient where patients can come, they can see their physician, they get treatment. Some of them do that all in the same day. Some of them do it on different days. It just depends what they need, but they have all that service all in one place for them. So the physician's offices on the other side, we have 2 medical oncologists on staff. We also have a board-certified nurse practitioner in oncology, and so 3 total providers that see many patients throughout the day. All of our physicians' areas are set up the same. They have many exam rooms. They have their own private offices where they can provide consultations to patients if they choose to, or they can, of course, just use the exam room if they like. We have a general nurses station where our nurses are actively involved with patient care and patient teaching throughout the day. We also have 2 private consultation rooms for providers or for nurses, because generally with cancer, people are thrown a lot of information the first few treatments, especially the first few office visits that they have. So therefore, they oftentimes bring a lot of support with them, a lot of family members or friends. So we've tried to have areas for them to be accommodating to those areas, those people, so that everyone can hear the same information and provide a lot of support to the patients. Again, we have another separate area. We've tried to separate our providers so that it doesn't get too congested and give patients privacy if they choose. So we have our second provider office and second nurses station, where we also see our nurse practitioner patients.
How many patients do you see through the day?
Each provider probably has anywhere from any given day, anywhere from 20 to 30 patients on this side of the clinic, sometimes 35, sometimes more. And in the general infusion area, we may see anywhere from 15 to 30 patients on a given day, just depending on the volume of and the day of the week. Patients kind of choose their days of treatment. So obviously, not everybody wants to have chemotherapy on Friday and ruin their whole weekend, so more patients are heavier during the earlier part of the week. We also have an office for our patient navigator, Liz Bissett. Liz is a patient navigator and helps patients navigate their way through the entire oncology process and their whole cancer treatment diagnosis, whether it's an inpatient stay or their outpatient visits, whether they need special social services, transportation services, financial assistance. Liz helps navigate the patients through that process and get connected with the right resources, whether it's here in the hospital or within the community. We're back to the waiting room. We made our big circle. Again, we have tried to separate the clinic itself from the hospital a little bit to try to give patients the convenience of that they're still just coming to a clinic setting, yet being close to the hospital, so our providers can easily see patients if they are in the inpatient stay. The physicians can easily drop by and see their patients there, then come back and see their clinic patients. We do have a special elevator just for our cancer patients that services. They drop by our special valet services that we have in our entrance. They can easily come up to the cancer center for their infusions or the office visits, or they can go down to our ground floor where we have our radiation oncology center.